Hi everyone, my name is Zach, and today I'm going to be talking about stroke, also known as a brain attack. Before I talk about what a stroke is, I think it's important for us to understand the mechanics and functions of the brain. Depending on which lobe we're talking about, the brain controls majority of our daily activities. For example, the frontal lobe controls majority of our motor functioning, our parietal lobe controls touch perception, occipital lobe controls our sight, temporal lobe controls majority of our auditory processing, and our cerebellum controls our balance and coordination. Just like many parts of our body, including our muscles, our brain needs oxygen from our blood to work efficiently. Although our brain is not the largest organ in our body, it uses up about 20% of the oxygen that we breathe. Basically, what that means is that oxygen travels to our brain for it to function and work and control all of our daily activities. A stroke is a sudden interruption in oxygen circulation to the brain from our blood supply. The key word here is sudden. The longer it takes for us to determine and recognize that a stroke is occurring, the more detrimental it is to the health of the individual suffering from that stroke. Now, there are two types of strokes. The first one is an ischemic stroke, in which something blocks our blood supply to parts of our brain, resulting in cerebral hypoxia. Hypoxia meaning a low level of oxygen. Now, if it gets even worse, the individual could suffer cerebral anoxia, in which there are high levels of oxygen that are being deprived from the brain. Some examples of things that could block blood flow is blood clots, as well as fatty deposits that can solidify over a period of time. Now, there are other types of strokes as well that are not as common, but they do exist. The first one is a transient ischemic attack, also known as mini strokes. There are also cryptogenic strokes, in which the origin or the causality of the stroke is unknown. And finally, a brainstem stroke, in which the oxygen circulation of the brainstem is being blocked, meaning that not only does one part of the body can be affected, but both sides, since it's in the middle. Now, when either strokes happen or any of these strokes happen, parts of the brain that were affected become damaged or die, also known as cerebral infarction or brain attack. Just like our heart, when we have heart attacks from lack of oxygen, our brain, due to lack of oxygen, goes through a brain attack, resulting in a decrease in function or a complete loss in function to parts of our body. As you can see on the map to the right, strokes happen in the United States pretty often. Every 40 seconds, a stroke occurs, and every 4 minutes, a death occurs due to a stroke. In the United States, every year there's about 795,000 strokes that happen, three-fourths of those strokes being first strokes or new strokes, and the remainder being reoccurring strokes of those who have had a stroke before. 87% of all strokes are ischemic, meaning that it is just a blocking of blood flow to the brain. And actually, it is more common in women to get a stroke than men because of various causes such as pregnancy, taking birth control pills, or those who have migraines with aura. Like I said in the beginning, strokes happen suddenly, so it's of our best interest that we are able to diagnose and recognize when a stroke is occurring. And we can do that by using the acronym FAST. F standing for face drooping, so we want to make sure that when the person smiles, that one side is not dropping. A stands for arm weakness. We want the individual to raise both arms to see if one arm is weaker than the other. S is speech. We want to make sure that their speech is not slurred. And if any of these symptoms or signs are present, then it's time to call 911 right away to get them to a hospital to diagnose them efficiently to make sure that if they are having a stroke, we're able to treat them properly. What's dangerous is that strokes can also be asymptomatic, so they might not be able to display any of these signs. The causes of stroke is natural, or one of the most common ways is increases in age. So as we get older, strokes are bound to happen, or if you don't take care of your health, it will happen. It happens at any age, but more so as age increases, so does the chances of stroke. Other things that could occur, or people are at risk with high blood pressure, high cholesterol, smoking, obesity, diabetes, and sickle cell disease. Sickle cell disease is when our blood cells are not naturally round, they kind of look like a sickle, and when they have blood like that, it tends to create more blood clots because it's not able to flow through the blood vessels smoothly. Some other signs and symptoms that could occur is sudden numbness, sudden confusion, sudden trouble seeing, sudden trouble walking, sudden severe headache. So like I said, strokes are sudden. So and if any of these happen all of a sudden, then you can assume or anticipate that somebody is having a stroke. Now, what happens after a stroke is depending on how severe the stroke was to what different parts of the brain, like the left side or the right side, there's different symptoms that could occur. So if damage happens to the left side of the brain, a patient can be expected to display paralysis on the right side of the body, speech and language problems, slow, cautious behavior style, as well as memory loss. If there are damage to the right side of the brain, they can expect paralysis on the left side of the body, vision problems, quick inquisitive behavior style, as well as memory loss too. Now, like I said, depending on the severity of the stroke and how damaged the brain is, these symptoms can range from minor to major, and depending on that could also determine how their lifestyle may change or may not change in the future post-stroke. Once an individual arrives in the hospital, there are two types of things that could happen as far as treatment. The first one is an endovascular procedure in which the surgeon inserts a long tube through a major artery in either the arm or the leg, and that tube is used to insert a coil that will either repair the damage of that specific part of the brain or prevent further bleeding. The second one is a surgical procedure or surgical treatment, and that usually happens for hemorrhagic strokes. In this, the rupture may require a metal clip to be placed in the damaged part of the brain to stop further blood loss, as well as blood spilling or entering into other parts of the brain. Like I said before, depending on the severity of the stroke and the effectiveness of the treatment, the individual might have to go through various types of management skills in order to either regain or to relearn different aspects of their daily living. The first type is speech therapy, in which they may have to improve producing and understanding speech. Physical therapy, in which they use exercises to relearn movement or coordination skills that they may have lost due to the stroke. Occupational therapy, in which they're able to improve daily activities such as eating, getting dressed, reading, writing, and everything that they usually do on a day-to-day basis. Now, they also should discuss a prevention plan with their personal physician to talk about things like managing high blood pressure, being active, eating better, losing weight, maybe even quitting or smoking, because of that being a high risk as well for getting a stroke. And usually, for those who have had a first time stroke, getting a second stroke is a lot more common, and preventing that will be one of the game plans as far as management. Again, I repeat, depending on the severity of the stroke as well as the effectiveness of the treatment, modifications may be necessary from a minimal to a maximal type of degree. First, returning to work, for example, the American Stroke Association provides an employment readiness checklist that'll help to determine whether an individual is ready to go back to work or if they should recuperate and recover for a little while longer. They're also able to qualify for Social Security disability, in which they're able to receive some type of stipend since they're not able to work to the capacity that they used to be able to. Some home modifications may be necessary as well for the bathroom, bedroom, and kitchen. Some people might be in a wheelchair due to not being able to use their extremities as much as they could prior to the stroke. So, for example, the bathroom would have to be modified so that they're able to brush their teeth, the bedroom so that they're able to get into bed, and the kitchen so that they're able to prepare a meal for themselves, whether or not they live alone or if they live with others. And a helpful website that I found is abilityjobs.com, and what's great is that all of the jobs that are posted on this website are either made or tailored to those who have a disability or an impairment. And what's good is that during the pandemic, they've also incorporated an ability job fair virtually so that those who are looking for work during these hard times are able to do so from the comfort of their own homes if they're afraid to go out, especially during this time. here are the references for my presentation.